It is possible that in the past, some people with schizophrenia may have been mistaken for being possessed by demons or evil spirits. This is because the symptoms of schizophrenia, such as hallucinations, delusions, and disordered thinking, can be difficult to understand for those who are not familiar with mental illness. In ancient times, many cultures believed in the existence of supernatural forces, such as demons or evil spirits, and these were often used to explain unusual or abnormal behavior. People who exhibited symptoms of mental illness, including schizophrenia, may have been thought to be under the influence of these spirits and subjected to various forms of exorcism or other religious rituals in an attempt to drive out the supposed demons. However, it's important to note that the understanding and treatment of mental illness has evolved over time, and in modern times, schizophrenia is recognized as a medical condition that requires proper diagnosis and treatment.
Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It is a complex disorder that can cause a wide range of symptoms, including hallucinations, delusions, disordered thinking and speech, and a lack of motivation and emotional expression. The onset of schizophrenia usually occurs in late adolescence or early adulthood, and it can have a significant impact on a person's ability to function in their daily life.
There is no direct link between schizophrenia and serial killing. While it is true that some serial killers have been diagnosed with schizophrenia, the vast majority of people with schizophrenia are not violent or dangerous. It is important to remember that serial killing is a rare phenomenon that is not specific to any one mental disorder or condition. There are many different factors that can contribute to the development of serial killing, including childhood trauma, social isolation, and a lack of empathy for others. While some serial killers may have had schizophrenia, it is important to recognize that the vast majority of people with schizophrenia are not violent and do not pose a threat to others. It is also important to avoid stigmatizing people with mental illness, as this can contribute to further misunderstanding and discrimination. Schizophrenia can be difficult to diagnose, as there is no single test or symptom that definitively confirms the presence of the disorder. Instead, health professionals typically use a combination of methods to arrive at a diagnosis. The diagnosis of schizophrenia typically involves a combination of methods, including a clinical interview, evaluation of DSM-5 criteria, medical tests, additional assessments, and long-term observation. A thorough evaluation is important to arrive at an accurate diagnosis and provide appropriate treatment for the patient.